virtually met me or you've met me in person. Those that have virtually met me, I'm sure one day we will meet in person. That will be nice, won't it? So we can meet
Definitely.
up in person. Right. So we are going to put our phones and our devices on mute, which is the house rules. I will ask you questions and you'll just answer me with a thumbs up or a thumbs down, okay? I will give you the opportunity at the end to unmute as we do normally, and we can have a little chat of what we've looked at, and anything that you don't understand, please, so you can ask me, and we can go back and we can check on what is happening. Right, so we will be looking at today a new unit, and this unit is infection prevention, and in brackets, the dreaded COVID-19. Okay, so this is infection prevention, COVID-19 for beauty therapy and nail services, okay, which will include us. This is a level 2 qualification, and I just want to go through the overview of what you're learning and why you're learning it. So the aim of this course is to develop the learner's knowledge and understanding of how to prevent the spread of COVID-19. I almost sound a little bit, I feel a little bit like Boris here, but I haven't got my 2 advisors thanking me. So I hopefully within these few weeks, help you how to understand to stop or prevent the spread of COVID-19 within our workplace. Okay? So the whole purpose. It will learners will develop the knowledge and the importance of social responsibility and the causes of transmission and effects of COVID-19, and the methods in which we as therapists can control its transmission. Try and say that fast. So how we can control the transmission of COVID-19 in our workplace. Obviously, we don't want to just take this information and keep it in our workplace. We can take this information and use it at home, yes, in our daily living, because it is our responsibility as this nation to help to stop the transmission of this virus. Unfortunately, it sounds as if this virus is going to be with us for quite. Yes, it's like our flu virus that goes away, comes back, goes away, comes back. It's going to be with us for quite a while. So it's really important that we understand how to control it, how to make sure that we're protecting ourselves, our client, and even our families, because we have to go home to our family. Okay, we need to look at things such as correct hygiene, personal protective equipment. Now, this will make you smile, because when that first came up on the news and everybody was talking about PPE, and people go, what are PPE? Beauty therapists have been using PPE, which is personal protective equipment, for years. We are probably one of the safest industries when it comes to actually working with our clients, because we wash our hands before, during, and after our treatment. We wear gloves in certain treatments. We wear masks in certain treatments. We wear aprons in certain treatments, long before COVID. So we, as an industry, are one of the safest industries out there. The only thing we didn't really wear was those lovely visors that steam up under your glasses if you wear glasses. So your mask steams up, sends it all up to your glasses, and then your visor steams up, and then you can't read. But we had all these things in place as an industry already. So we are quite safe. So don't let anybody say to you that, you know, a bad industry, it's close contact. We know it's close contact, and it's easy transmission. A beauty therapist had that responsibility in place anyway. Okay, second nature to us. Okay, they will also understand safe working practices that will be required in a beauty salon or a nail bar. Things, and we know that that's the first thing when you come for induction. You need to risk assess to protect yourself, your client. Yes? So it's nothing new to us. Right. So I've gone through the aims, and that's your learning outcomes. This is all available to you as well as your books, which we're going to have a look at. So here it actually goes into how the contents of what we're going to learn, how infection can spread, chain of infection. I've overskipped, ladies. So yes, chain of infection and how we can break this chain of infection. And that's continuing. Nice long one. Social responsibilities. That's us, our social responsibility. And then we'll be looking at social responsibility in our own roles. So we're looking at social responsibility as the community and our own role as therapists. We'll also be looking at health and safety. Health and well-being, I should say. Health and well-being of client and your staff. So not only your staff, but also your clients. Yes, keeping them safe as well. Okay, and this is going back into breaking the chain of workplace standards, infection and procedures, the role of risk assessment and prevention of COVID-19. So we're going to tell you what is a risk assessment, how it works, social distancing, respiratory hygiene and cough etiquette, recommend personal protective equipment we're talking about, and that's in beauty therapy and nail services, and going a little bit more detail about our PPE. Okay. In March, way back in March, when things were really, really bad, a lot of, and obviously salons were closed and nail bars, a lot of companies actually donated their PPE to the hospitals, etc., because we already had it in stock. As I said, it's something we used, so we did. We're going to also look at hand hygiene, and I think that's it. Personal hygiene, the potential hazards and possible risks in relation to COVID, safe hygiene working practices within our salon, and treatment times, hazards, that's our risk assessment that we're going to have a look at those. Let's just move one up. Okay, and decontamination, how to decontaminate our tools and our salons. So that's quite a new one. How would we decontaminate? Looking at things, what is decontamination? Waste management. I think that's about it. So you will be seeing me every lesson. We'll be going through our PowerPoints. Remember, you will have access to everything that I've gone through here. You will also have access to your workbook. Now, that's the next thing I'd like us to have a look at. The workbook is where you will be doing your homework. Now, you need to complete this workbook. Lost your share page, bear with me. Screen sharing has stopped. Okay. Right, so please bear with me just a second, ladies, as I get your work. Workbook. Okay, right, I'm just coming back on so that you can share. Right, and please give me a hands up, a thumbs up if you see my screen. Yeah, perfect. Good. So that was good. So we share. Excellent. So this is your learner workbook. This, all the pages and all the questions will need to be completed as part of the course. Now, this will be done in several ways. We will be doing homework. As those that know me know, I like to give homework. Okay, so we will be doing homework. We will be in class completing some work together. Okay, and we then will be sharing good practice within our group. So each page in every section will be completed. This is your learner workbook that you will have access to. And again, it's got your learning objectives, learn. And I could have just gone on there instead of scrolling through the whole learning resources. You need to make sure your learner name is on there. And the introduction, it tells you exactly what I've just told you, what you're going to learn, and then it will go into all your questions. Now, at the end of each session, I will be setting your homework and I will be asking you to complete the questions. I will tell you the number of the question and the ones I want you to complete. The second time we actually come back, so the next lesson, I will start the lesson by asking you, how did you all go through your homework? Was there any questions that you weren't sure of, etc.? So when you are completing your questions, if you cannot find the information or you're not sure of the answer, please make a note so that we can revisit this question at the next lesson. Okay? Thumbs up? Thumbs down? Everybody's got that. Brilliant. Excellent. Well done. Okay, so that is our learner workbook. So very important, it does need to be fully completed. When this learner workbook is completed fully, you will then be sending it into our email, you know, where you enroll email, and it will then be marked. Okay, it's not going to be marked on these sessions. Actually, it needs to be sent in to be marked. Once it's all been marked, it's going to be 100% because we've been going through the answers through here. Once they're all nicely marked, we will then contact, and you still, as well as your workbook, you have a nice little test to do. Remember, our tests are nothing to worry about, students. Multiple choice, all the information is here, and then we will contact, or you can contact, I will tell you at the end of the course which way it's going to be when you're ready to do your test. Okay? So that's our information here. Right. So let's start. I might lose you for a little bit, guys. No, that's perfect. That's what I wanted to do in the first place. Okay, so let us start off with our first power. Everybody seeing that? Can you all see that little picture from me? Yes? So you're all sharing. Perfect. Well done. Right, so let us start with our infection control. As I said, I feel like one of Boris's little aides, or Boris himself, giving you information of what you must do and what you mustn't do. So actually, is this the slide? Okay. Oh, no, that's not the one I wanted to start with. Sorry, ladies, bear with me. I want to start on another one. Okay, I know you haven't got anything at the moment, so let's share. Right, okay. Okie dokes. Right, okay, we're up here now. Sorry, ladies, it's in a different order than what I had, so I just have to find. There we go, number 1. Right, that's a little bit better. Right, thank you. Thank you for bearing with me. Okay, so let's start at the beginning. How infection can be spread. An infection occurs when a pathogen or a disease-causing bacteria or virus enters the body.
Hello.
Hello.
Hiya, Debbie. It's Sabrina. Sorry, I think we're still seeing your file explorer rather than the file.
Oh, right. Okay. No worry. Let me see if I can do a new share. Right. Okay. Where? Bear with me, ladies. Okay. No, that's not the one I want. Can you see this though, Sabrina?
Yeah, we can see that now.
Right, but that's not the one. Okay, so bear with me again. I just wanted to see if I could get it up.
It's just at the top, learning outcome 1.
Okay, lovely. Thank you.
No problem.
Let's see if I can share. Are you seeing this?
That's the one. There you
Perfect.
go.
Excellent. Sorry, ladies. And you were so polite, all you ladies. You were sitting there letting me talk away and you weren't able to see it. Next time, thumbs down. Show me your thumbs down when you can't see it, okay? That's me talking away. Right. Infection is spread. Yes? So an infection occurs when a pathogen or a disease-causing bacteria or virus will enter the body, and there it will multiply. It will then dispersing normal body functions and will damage body tissues. Microorganisms such as bacteria and viruses require certain conditions to grow and spread, such as temperature, moisture, nutrients, and time can be passed on via bodily fluids such as saliva and mucus. In the case of COVID-19, poor hand hygiene or standing too close to an infected person can provide the perfect conditions for the spread of the virus via respiratory droplets. Now, we may have heard some of this information. The government and the media do try to say, this is what's happening. Please don't stand too close to one another. Please don't shake hands. When you cough, please cough into, tissue, or please wear masks. Yeah? So we need the information of how the bacteria can spread. Common causes of the spread infections are as I said, lack of hand hygiene, poor or lack of cleansing procedures in your salon or wherever you're working, lack or incorrect use of PPE. PPE, one of your masks, your face mask is PPE. How many times, if you see out in public, London transport, have you seen somebody, I'm wearing a mask, it's down here. Yes? It's even down here, I've seen them wear it on their chin. It's supposed to be covering your nose and your mouth. So they will think, I've gone out, I've done my bit, I've worn PPE, I've worn my mask. But your nose isn't being covered, or your mouth isn't being covered. Wearing it on your chin, I'm not quite sure what it does for everybody. Even the person wearing it must be quite uncomfortable. But these things that we're doing wrong, lack of hand hygiene, not washing for 20 seconds, lack of cleaning the area. Yes, no point saying I've got all my PPE, I've taken your temperature, I've done everything, but my door handles are not clean or my surfaces are not clean. I'm going to pass that on. And also use of contaminated equipment such as tools. Again, very important with therapists. We always like to sanitize and sterilize our tools. And you're going to see a little bit further how long these viruses can stay on tools and even linen, even towels, uniforms. Yeah, so it's not only our hands, it's actually even a pen. Ideally, you should be using your own pen throughout the whole day. I now clip my pen onto me. I bring my pen in and I use it all day because we're so used to, can I borrow your pen? That bacteria, that virus is sitting on that pen. And that's a very easy way to pass around. Not in our lovely virtual classroom, but it's an easy way to pass around. So routes of transmission can be direct, for example, person to person through contact, touch, hands, that's why we're not allowed to shake hands, or indirect, for example, in the air from contaminated objects. So it could be in the air, a cough, it's in the air, sits in the air for X amount of time, our pen, this is contaminated, yes? Or it can be things that are contaminated, for example, via blood. So do you see why it's important that we must look at our tools? Yes? Even a file, a nail file, and we've got a little cut there, a little bit of blood may go on, but usually we'd be okay with it. That's contaminated now, that's going to sit on your file. Yeah? So general infection can pass into the body through the respiratory tract, and that's when you inhale airborne pathogens. Skin, we just spoke about the skin, open or broken skin, open wounds, broken skin. Urethral or reproductive tract is a passage of bacteria into these tracts. The urethra is the toilet, when we're going to the toilet. Yeah? You notice that when we, earlier on in March, all the toilets, public toilets were closed, not only for contact touching, but also it's very easily to get bacteria. Yeah? Reproductive area. Don't need to go any further, do I, guys? But reproductive. Okay? COVID-19, through the respiratory tract, is contracted through the respiratory tract, the eyes, the mouth, and the nose. See why I've got that vein about wearing my mask down here? It can go up through the nose. Wearing my mask on the chin, the mouth, and the nose, it can enter. Even touching my pen and then touching my eyes, it can enter through my eyes. Okay, so again, we need to be aware of how this is spread. And what we need to do is look at the chain of infection. The chain of infection is a series of events that enable bacteria, fungi, or viruses to cause an infection in the person. First of all, you have the pathogen, which is an organism capable of causing disease in a host. And that's how it looks. Can you see it going down the throat? So remember I said it sits in the air? We can breathe it in into the host. We become the host. Stages. So infection occurs when a pathogen or microorganism enter the body, increase in number, and then they will damage the body tissues. Okay, that's an infection. So there are different stages. First of all, we've got the agent, the pathogen which causes the disease. Yeah, so the first thing that causes the disease. Then we have something called the reservoir. The reservoir is the environment where the pathogen survives, for example, people, equipment, or work surfaces. So we've got COVID. Okay, this is COVID, my lovely phone. Okay, that's the infected agent. The reservoir is going to be my pen. Okay, so COVID is stuck to my pen. Okay, so we've got from COVID down to the reservoir. Then we have the portal of exit. This pathogen leaves the reservoir, for example, through coughing, sneezing. So remember that's the reservoir, COVID stuck to it. Now it's going to enter me. Yes? So my pen might be able to sneeze, cough, whatever, is now going to enter me. We'll have it sitting up here. And then we have the mode of transition, how the pathogen is passed on through direct contact or inhaling. So I'm going to put it direct contact. It's touching me now. Yeah? So that's the point of entry. So we had the infectious agent, we had the reservoir, we have the portal of exit and the portal of entry. Then we have the host, suitable host. This is the individual at risk of infection. With COVID-19, who is the suitable host? Is it just any person or is it all of us? It is all of us. Yes, we are all suitable hosts. This can be passed on to all and every one of us. Even if we've had it before, they're not sure. I'm just going to pull this, ladies. I can see that light going through. That's a bit better. Even if we've had it before, they're not sure how long our immunity to this virus is going. Nobody knows at the moment. Is it 6 months? Is it 6 weeks? Is it 6 years? So we are all susceptible. And there's a lovely picture of the chain. So it goes round in the chain. So you've got the infectious agent, the reservoir, the portal of exit, mode of transition, portal of entry, susceptible host. That susceptible host will then pass it on. And it just keeps going round and round in that circle. Yeah? So let's look at the lovely coronavirus. Coronavirus are a large family of viruses that can cause illness in animals and humans. In humans, they can cause disease which have mild effects, such as a common cold, through to those that are severe, that cause severe life-threatening illnesses, such as SARS. SARS is severe acute respiratory syndrome, and MERS, Middle East respiratory syndrome. So we've heard those SARS and MERS words being passed about and bantered about, but this is what they mean. So you can have something that's like the common cold, which we all catch, unlike our mothers and dears told, oh, going out with wet hair, you're going to catch a cold. You cannot catch a cold from wet hair. You can catch a cold. It's a cold virus. I can catch it from somebody else or another host. Okay? So the term corona is derived from the Latin word meaning crown, as the virus has spike-like projections on the surface which resemble the appearance of a crown. This is how our lovely coronavirus looks, if we were going to look at it under a microscope. The SARS, as I said, severe acute respiratory syndrome, or SARS-CoV, first occurred in Guangdong province in China in November 2002. It's believed to be an animal virus which crossed over the species barrier to humans. It spread internationally and caused local social and economic disruption and disruption to the international travel service. The epidemic lasted until July 2003. Then we had MERS, which was the Middle East respiratory syndrome. Coronavirus, or MERS-CoV. This was identified as in Saudi Arabia in 2012, and 80% of human cases have been reported there. It's transmitted primarily from the dormitory camels to humans. So from camels to humans, but human-to-human transmission is also possible. Okay, so that's a SARS and MERS. So you know the difference. These are COVID viruses, just different ones. Okay. In December 2019, a new virus was detected in Wuhan, China, novel coronavirus, or SARS-CoV-2, which causes the disease coronavirus, 2019. Hence, we get the word COVID-19. Okay. This quickly spread around the world, and a global pandemic or epidemic, which occurs worldwide, was declared in March 2020 by WHO, which is the World Health Organization. So when you see the word WHO, it's the World Health Organization. And the rest is history. We know about that, don't we? How fast that took off and went all around the world, and all the transmission and all the discord and death that this has caused. So COVID-19 symptoms and signs. The main symptoms of COVID-19 are a high temperature, new continuous cough, and loss or change of senses, smell and taste. They really sound like one of these ladies in that conference. So fever, cough, loss of taste and smell. Also, other signs, these are less common, but these also can be signs, is sore throat, nasal congestion, headaches, conjunctivitis, skin rashes, diarrhea, aches and pains. Conjunctivitis is an eye infection. Yes? Makes your eyes nice and red, really itchy. So these are other things that we need to be looking out for. These things we need to be aware for ourselves to see if we have those symptoms. We also need to be aware when we're speaking to clients. Yes, they might say, no, I have not had COVID. I've only had a headache, sore throat, diarrhea, aches and pains. That's nearly most of that list. But I don't have coronavirus because I can breathe and I don't have any fever. Right, so coronavirus is spread through the close contact with an infected person. It is spread primarily from person to person through droplets from the nose or mouth. Usually when a person coughs, sneezes, or speaks, the uninfected person breathes in these droplets of the infected person. Hence, we want you to wear the face mask. Yes, so you cannot breathe in those droplets. Even when somebody's speaking to you, if I was in person, not virtually, speaking to you, there would be some droplets that would expel from my mouth, and you would inhale them in. The droplets can also land on objects and surfaces around the affected person, or be passed on when the infected person coughs or sneezes into their hand and then touches an object or surface, such as a door or a light switch. An intimate object contaminated with infectious agent is known as a formite and can be porous, such as clothes, paper, or non-porous things such as metal or plastic. So that means a virus can actually sit on these substances for so many hours and be infected. The infection may be passed on when the object is touched and the person then touches their own face, and in particular their eyes, their nose, or their mouth. So again, that's why they say, please do not touch your face. Who can spread it? You've got the pre-symptomatic person who has come into contact with the disease, but they're not yet showing symptoms. You've got the symptomatic person that's exhibiting signs of the disease, well, all those signs we've just seen, and the asymptomatic person who has come into contact with the disease, but they just show no signs. Okay, they still have coronavirus, they come into contact, but they're perfectly well. Okay, so these people can spread it, which is everybody then, doesn't it? You've got symptomatic, asymptomatic, pre-symptomatic, that means everybody can. Oh, sorry, going off one there. Okay, so the little people here. Does the new coronavirus affect older people or young people too susceptible? People of all ages can be infected by the new coronavirus. Older people and people with pre-existing medical conditions such as asthma, diabetes, or heart disease appear to be more vulnerable to becoming severely ill with the virus. But that does not mean the younger people do not get the virus. So the older people, they become more, or they have pre-existing conditions, tend to be more vulnerable to becoming ill and ending up in the hospital. Okay, who advise people of all ages to take steps to protect themselves from the virus. For example, by having good hand hygiene and good respiratory hygiene. Everybody is at risk. Every single person, no matter what their age is. Right. So this is the important thing, and I think that we do need to, because a lot of people are not aware of this slide. COVID-19 can survive on plastic or stainless steel up to 72 hours, 3 days. So I can come to your house, knock to your door. I've got COVID because I didn't wash my hands and I'm coughing and I'm doing everything else. I touch your phone, say, oh, let me look at your phone. COVID has gone from the phone, my hands onto the phone. That will sit there for 72 hours, 3 days before that virus has died. That's a long time. You probably have forgotten I'd come and picked up your phone by then. Yeah? Copper, it stays there for less than 4 hours. Cardboard, less than 24 hours. Okay? So things that we must remember. Plastic or stainless steel, 3 days. Copper, 4 hours. Cardboard, less than 24 hours. Cardboard is disposable. So that, as beauty therapists, we want to remember things that can be disposable might be the best things that we need in our salon. Because we can just throw them away straight away. And a lot of the things in our salons are disposable. Okay, so that's slide number 1, ladies. I'm just going to pick up 2. We are going to have questions at the end, don't worry. First of all, can we see that? Yes or no? Thumbs up? Yep, perfect. I don't want to be talking away, you guys can't see. There we go, right. So we're on to slide 2. And we're looking at social responsibility. Our responsibility as a community. The practice of producing and supplying services in a way that is not harmful to society or environment. That's the responsibility. So it's our way of producing or supplying a service, yes, that is not harmful to society or the environment. Socially, we need to be socially responsible for business, to operate our business, to operate in a way which is best interest of our staff and our clients and our community around us, the society at large and the environment. Okay? There are benefits for the local and national community, staff and clients when the business practice social responsibility. So all those things that we put together, that we make sure our service is not harmful, we make sure that the things we do are in the best interest of our clients, community and environment, this is social responsibility. The effects and the benefits of social responsibility are far-reaching, and everybody has to play a part in relation to COVID-19. So when we are carrying out our social responsibility as a business, we need to demonstrate ethical behaviour, accountability, transparency, respect for all stakeholders, consideration for central names or norms behavior. So consideration for social or normal behavior, respect for human rights, compliance with the law, legislation, and promote a sustainable working practice. The beauty therapist or the nail technician needs to be socially responsible through adhering to the advice provided by the government guidelines, which affect both working and personal life. So there it's saying we need to abide by the government guidelines, whether it be at home, whether it be on the bus, whether it be in our salons or nail bars. For example, it's important to maintain the specified social distance to prevent spread of COVID-19 and to comply with legislation around the workplace operations. We need to adhere to or stick to the government guidelines in the country wherever we are, and we need to stick to or adhere to the workplace policies and procedures in relation to COVID-19. So there's no point, ladies, us cleaning our house at home, making sure everything's clean, everything's sterilized, and we wash our hands with antibacterial gel. I spray on my clients' feet and everything. Sorry, my visitors' feet, only 6 of them. Yes, including 5, including me. Okay, and I followed everything the government says. Then I go to work. And on the train, I put my mask on and I do what I'm supposed to do. I go into work and I have 20 people in there. There's no social distance. I'm not taking any temperatures. I'm not cleaning. You understand? It needs to continue from home to work, from work to home, for us to actually combat this virus. So we need to look at the health and well-being of our staff and clients. In order to maintain the health and well-being of the staff and clients, it's important to follow current government guidelines in the country wherever we are. So that's here. We need to be watching Boris, we need to be watching the news. We need to know what the rules are. I know they're very confusing, depending where you're living at the moment. Hopefully they're going to do something to help that. But we need to know, because I may live in a certain area and I may work somewhere else. There might be different rules. I might be going to visit somebody's workplace or work there for the day and I don't know what the rules are. We need to know what these rules are and we need to make sure that we follow them. Okay? We also need to establish protocols and procedures in relation to COVID-19 for our beauty salon or nail bar. We need to put procedures in place. For example, stay at home if we're feeling unwell. Not be that martyr. I've got to go in. I know I'm really feeling unwell. I've got to go in because I need to make £300 today. Yeah, not good. We need to avoid close contact with people who are sick. So if somebody's sick in the home, guys, we need to avoid close contact with them. We should all be self-isolating anyway within that home. We need to wash our hands for at least 20 seconds. Often through the day, not just at the beginning in the morning because I remembered, and then when I got home because I've forgotten all day long. Throughout the day, you need to cover your cough or sneeze with a tissue. Avoid touching the eyes, the nose, and the mouth with unwashed hands. We need to clean and check our services, and we need to avoid crowded places. Okay. So I'm going to do one more PowerPoint and then we're going to have a little talk. Right. Just have a look at that. Sorry, ladies, let me just see if that was the one that I just said to you. I think it was. Yes. Oh, no, that's the one. Right. So we looked at the chain. yes, of infection. Do you remember we had a quick look? We need to now look at how can we break this chain of infection, because that's how we were going to prevent the virus from being passed on. Yes, we need to break that chain of infection. So, of infection, it's essential that we break it at one point at least. So if we've got our circle where it continues, keeps going around, if we break it, it no longer becomes a circle. So remember, let's remind ourselves, remember we had the infectious agent or the pathogen, we had the reservoir, we had the portal of exit, and we had the mode of transition, the mode of entry, and then our susceptible host. So at some point, we want to break that. Yes, so it will not continue into that vicious circle. And then we just end up passing this virus on and on and on. So standard infection control precautions tells us how we can break this chain. We need to risk assess. Now, risk assess is looking at something that can cause us harm. We're going to go in a bit more detail, so I'm just going to do this very briefly. That was something that can cause us harm, and then we need to look at how likely it will cause us harm, and what are we going to do to stop that. That's a break in the chain. So one of the things could be risk assess. Regular washing our hands, because we're washing that virus off our hands, aren't we? So I won't be putting it on pen. I won't be putting it on my phone, because the virus should be washed away. We use hand sanitizers. That's why the government advised that you use hand sanitizers in every shop as you enter. Now, the supermarkets, I noticed, have sort of lapsed on that, the ones I went to, but they have a spray there that you can sanitize your basket. Yes. We'll talk about afterwards. I've seen little lapse in the hand sanitizers. Beauty salon nail bars right at the start, before they go any further, you need that. The use of PPE, personal protective equipment, such as face coverings, which is our masks, gloves, aprons, etc., and also safe management of linen. Yes, remember we use towels, etc. Where we have to use towels, we need to make sure that we are manage them correctly, so we're not passing on the virus. And there's a lovely how to wash your hands correctly. That would be, if you have a salon, that would be nice to have in your salon. That would be lovely to put up on the wall. So especially in the bathrooms, how to wash your hands correctly. Should be for 20 seconds minimum. And you should be able to follow those 11 steps. So that's a nice little poster there. Breaking the chain of infection, carrying on. Respiratory hygiene and cough etiquette. There is an etiquette to coughing, which we're going to have a look at, believe it or not. Safe management of equipment, safe management of service environment, safe management of blood and body fluids, safe disposal of waste products, including sharps, and occupational safety, managing prevention of exposure to sharps. Now, again, as a beauty therapist, 9 out of 10 of these things we do anyway. They're not new to us. We are a very safe industry. And when I looked at all this, I thought, but we do this. Second nature. So if you're new to the industry, this will just become second nature. You are an old therapist that now wants to do infection control. This will be nothing to you, because we do this. We do it constantly. We just have to ourselves. The additional precautions we need to add, which we probably didn't have before, was the social distancing. Okay, which isn't it 1.5? I think it went to 1.5, and then it's gone back to 2. Again, very confusing. I believe it's gone back to 2, but it had gone down to 1.5 if you could possibly do it. Again, a little bit confusing. We need to, if we could, immunize. We're waiting for a vaccine where possible. Now, I'm not going to talk about this vaccine because I'm not I'm not too sure about that. So if we do get a vaccine, whenever we get a vaccine, that would be great. Everybody would have a vaccine and would be immunized against it. We need to check our temperatures. Yes? So that's important. The minute you walk into that workplace, check your temperature. Because you wouldn't really do it at home. So temperature checking. Anyone entering the premises is required to undergo a temperature check in accordance with local and national guidelines. It is a requirement. It's not a request. It's something that you have to do, whether it be your staff members, whether it be your clients. You need to check their temperature before they enter. Okay, and there's a little question I'm going to ask you when I unmute your mask, your devices, just to make sure everybody knows. Well, I just checked your temperature and it was fine. So we'll come back to that. So, things that we must have as standard procedures. Remember I said you have to have procedures in place? You really have to have these in place in your nail bar, in your salon. We need to have risk assessments, infection, protection, control. Infection, protection, control. These all together, all these things all together make up our infection control. Again, another question I'm going to ask you. We need PPE, which again, not very strange to us therapists. We need to make sure we have good hand hygiene. We need to promote the promote safe working spacing. So we can't be all next to each other, though we love each other and we go to work and we like to be friends there. We still have to have our social distancing. We need to look at our waste management and we need to educate. And this is what we're doing. We're starting on the road the right way, aren't we? Because we're educating you. Yeah, you can't do things if you're not sure why you're doing it or what you need to do. So, the role of risk assessment in the prevention of COVID. The risk assessment is a careful examination of what in the workplace could cause harm to people so that they can, so that you can assess whether you have taken enough precautions or should do more to prevent harm. So risk assessment for COVID-19 is looking at the workplace as a whole, looking at things that I think can cause harm or, in this case, pass on COVID-19, yes, to myself, my work colleagues, and my clients, and then figuring out, have I taken enough precautions to prevent this from happening? It is a legal requirement to assess the risks of the workplace so that plans can be put into place to control and minimize these risks. The law does not require all risks to be eliminated, but people need to be protected as far as possible, as reasonably possible. So the law's not saying this phone is a little COVID hub, yes, because if I touch it or when I open it, it coughs COVID droplets out. It's not saying I need to take it away because I may need it in my salon to play nice relaxing music. Maybe that's the way how I play my music. Yeah, so when I'm doing a body massage. So I need to look at my phone to see how I can prevent one of my colleagues coming, picking it up, and then this screen is full of COVID. I could just clean that, couldn't I? I could do all the services, make sure I wash my hands, make sure I use gloves. There's all sorts of things without me having to take my phone away. Okay, so that's our risk assessment. I look at the thing, I look at the risk, and I then look at how am I going to diminish, make smaller this risk. Process involved in risk assessments is identify the hazard. Okay, there's the hazard. Decide who might be harmed and how. It might be me, it might be my colleagues, it might be my client. Okay, so who and how are they going to be harmed? Because I said there was COVID on there. So when they touch it, remember we said it stayed if it's metal, 72 hours. So that's there for 3 days if I don't clean it. Evaluate the risk and decide on the precautions. Record the findings and then implement them. So we've decided we're going to clean the outside and the inside of the phone, make sure everybody is wearing gloves. We're going to clean that every hour. People need to wash their hands, make sure they wear gloves, make sure they have a face covering so they're not going to touch and pass on. Okay, and then we review the assessment and update if necessary. So if one of my colleagues says, yes, that was a very nice idea of everybody cleaning the phone, but it's now wrecked your phone because they put water in it. Okay, and I then need to turn around and think, okay, I need to look at this again. This is not working. So do you see? We review. So risk assessment, notification, and signage and publication is a very important thing. There's no point me knowing about how to wash my hands. I've learned, I've taught my colleague, but you may not know, and you've gone into the bathroom. So if I put that lovely poster up, you think, oh, is this how you do it? And you go in and you take 20 minutes. So signage is very important, yes, to educate the public. Okay, so the role of the risk assessment, it's for staff, as I said, clients, the workplace, it's for treatments and services. So these are things that you're risk assessing. Your staff, yes? Okay, so don't forget, in the past, we've looked at our more vulnerable people. If I know that one of my members of staff has asthma, let's just say, yeah, she's more vulnerable than maybe me, or one of my members of part staff is 75. Remember they said age and asthma. She's got underlying health conditions. So if she gets COVID, that's she's going to fare off worse than I will. Clients, the workplace, the treatments and the services. Now, I'm not going to go too much on that because we're going to do that a little bit later. There's a method of minimizing risk to the beauty salon and the nail bar, and also there are implications for insurance. Nowadays, obviously, we all have to have insurance, but if something does happen and you are going to be sued or there is an insurance matter, the first thing your insurance company is saying today, where's your signs? Where's your risk assessment? Did you train your staff? So it has insurance implications now. Social distancing. Individuals maintaining distance while interacting. Social distance is enforced to limit or prevent the spread of COVID. It's important to follow social distancing guidelines of the country, wherever you are. Social distancing will affect the workplace layout, for example, the communal staff and client areas. So where we could say if we had a client waiting room, yeah, we can only have one person in there instead of 3, maybe because the social distances, depends on where you are. Maybe where 4 staff members would work in a salon, we've had to cut it down to 2 because we need the social distance, depends how big the area that you're working on. Also, you need to remember that you've got clients, so you've got the 2 therapists, those 2 therapists will have 2 clients, yes? Is there enough room for 4 people and for those 4 people to social distance? Then you're going to have people coming in that are going to bring supplies for you. Are they able to visit the premises at all one time? All these people, my staff, my clients, my suppliers. Yes? And the postman coming in to give me a package. Can I get them all in with all social distancing at the same time? And the management of staff, clients and visitors. Can I manage them? Can my staff go and greet or go and get their clients in the little area that I have with social distancing? Yes, because don't forget, your staff has to social distance from your client. And if there's 2 of them, have we got enough room that they can have that social distance and have a private conversation? Because some of our conversations are private. I don't want to be shouting across the room to my clients. Oh, you've got a Veruca client. Okay. Let's put you over here then. Yeah. So again, these things need to be taken into consideration. Do you remember at the beginning, back in March, we had to wait outside supermarkets, the queues, yes? Because they had to social distance. They had to think of how many people they're letting in, how many people are shopping, how many people are putting things on the shelf. It's gone down a bit now, hasn't it? That's been forgotten a little bit, but that's where that has all come from. You need to take and have protocols in place. Now, respiratory hygiene and cough etiquette. Cough etiquette. It's important to maintain correct respiratory hygiene and cough etiquette to prevent the spread of COVID-19. I think this is so nice. I'm smiling here. Cough etiquette. What else? Okay, so to reduce the spread of microorganisms, we need to, this is the etiquette that we need to take when we're coughing. We need to turn our head, sneeze or cough away from others, which hopefully we all do anyway. Cover our mouth and nose with tissue when coughing, sneezing or blowing our nose. Discard of any tissues immediately aligned in with the foot pedal control. Cough, sneeze into the inner elbow, like this. Not the hand if you haven't got any tissues. Wash your hands or use hand sanitizer immediately after coughing. Ensure correct hand hygiene is performed immediately after coughing or sneezing. Tissues, hand hygiene facilities, and waste bins will be available at appropriate points throughout the beauty salon or nail bar for staff, clients, and visitors. And the use of posters throughout the beauty salon and nail bar can help reinforce the respiratory hygiene cough etiquette. Now, personally, I wouldn't really want to cough into my to my hand, but if I've got nothing else, then yes, I will have to to cough into it. And remember, this is old. This is from the flu. Catch it, yes, bin it, kill it. Yeah, so that's come out. Somebody's found that and dug it out. That came out ages ago. I remember that when they had other viruses on. So catch it in the tissue, put it in the bin, wash your hands to kill it. Okay, so we need those up. Right, ladies, we'll run over for about 5 minutes. I just want to grab your attention for another 2 or 3 minutes. First of all, you can unmute, and I just want to find out if anybody has any questions about what we've covered so far. So unmute, speak to me. I want to hear your lovely voices. No silence. Okay, is that?
I'm good. We're all good.
Laughing. Is that because it was all good, or you didn't understand the words I said, or?
No, it was good. It was
No,
good.
it was good. You're all happy. Right, so I have to give you some homework, okay, so that we need to cover. So your homework is in your workbooks, okay, and I would like you to complete page 1 to 13. 1 to 13 in your workbooks. In case your page numbers are slightly different from mine, that is question 1 to 27. Question 1 to 27, just in case we're on different numbers. Okay, I want those completed. Don't forget you have access to your PowerPoint. All the information is in your books. Complete those fully. Please complete it in black pen, ladies. Don't complete it in pencil. Complete it in black pen or blue pen. So you're looking at me as if to say, oh my gosh, so what if I want to rub it out? If there is a question that you are not sure of, just leave it out. Make a note of that question, and then I want you to bring it into the next session. Yeah, so at the beginning of the session, I will be saying, did your homework all go? And then you guys will be saying to me, Yes, it was lovely, except for question number 23. I'll say, Christine, tell me what's wrong with question number 23. What did you not answer? What did you not understand? And then we can go through it together as a group. Yes? Happy with that? Yes?
Yeah.
You should be saying yes to me. You know, at the end, I love to hear your voices. Yes, yes, yes. Everybody understanding. So pages 1 to... sorry, I've gone on to week 2, bless me. Right, 1 to 13, or questions 1 to 27, please. Okay, so next week we'll be moving on to our next PowerPoints. We'll be looking at our homeworks, and if anything comes, anything that you'd like to share as a group, because you guys are out there in this world, even if it's in a shop, I'd like to just make a little mental note. And you know, when I said to you guys in March, strictly you're outside because only X amount of people were allowed in the shop. And we had to do this one-way system. Do you remember that one-way system? I don't know if everybody remembers. I never done it. I was always going the opposite to where everybody else was going. Apparently you were supposed to go in one way and go around the shelves one way. And that's all gone. I don't know if it's just me in the shops I'm going to, but I don't see a one-way system. That's all gone. Now, I know that the shopkeepers are told to, now, not shopkeepers, but the shop workers are now told they have to wear a mask. That wasn't happening.
Hi, Debbie.
Hello.
Hi, it's Yvonne. Hi, everybody. How are you? I'm cutting in now.
Yeah, we're done, Yvonne. We're done.
Okay, I'm just cutting in because I'm mindful of the time.
Yeah.
Thank you, everybody, for your attendance and your dedication and concentration. It's absolutely marvellous. We would like to say thank you to Debbie. We feel that she's really put in quite a lot of preparation for this. And enthusiasm, and we've also lucky to have her experience in the industry. So can we all give Debbie a thumbs up, please? Yep.
Thank you.
I'm looking at your thumbs, looking at your thumbs, okay. Just to confirm what this is about, your infection prevention, the knowledge is about enlightening you. It's not there to frighten you, okay? Please, can everyone write this down? It's there to enlighten and not frighten. Yeah, so this is knowledge for you to gain. We feel that there's enough fear in the world, and we are not here to frighten you in any way. Knowledge is power. Okay, so what is knowledge, ladies?
Power.
What is knowledge?
Power.
Well done, and this is what we want. The other thing, you've got workbooks. These are absolutely marvellous, and we're happy that VTCT have provided this for us. You are able to print it off and write in it. However, when you're finally submitting it, it needs to be emailed and you need to do it in Word. Okay, so if you don't have access to this facility, you can print it off and hand it in, but it's not something we want to actually take a lot of time on when you come in for your sessions. We're offering Zoom sessions so that this can eliminate taking up a lot of time in the class, because we aim to do online marking for this. But for Debbie's sessions, if you want to handwrite it, you're welcome to, but your final submission of your work would need to be... Hello? Yeah, your final submission would need to actually be sent in by email. Okay, I don't know if Sabrina would like to add anything else to this.
Hi ladies, yeah, just I am cognizant of time, so I just wanted to reiterate that we've gone through 3 of the 6 learning outcomes today. In your workbook, there are the identical learning outcomes. So learning outcome 1 that we've gone through will correspond to learning outcome 1 in your workbook. So they do correspond directly to each other. We have gone through 3 today. So there's a lot of information to take in, which is great. So as Debbie said, pages 1 to 13, questions 1 to 27, it will be what you're completing for next week. Pages 1 to 13, questions 1 to 27. Okay, and lastly, ladies, before I let you all go, this is the first in a series of 4 Zoom sessions covering this information. So the next, including today's session, and 3 more sessions on the same weekly slot, Thursday 1 until 2. We've gone slightly over today, but we will be conscious of that next time. It's a series of 4 Zoom sessions, same slot every week, Thursday 1 until 2.
Thank you. Goodbye, everyone. Have a
Thank you.
Thank you.
Bye, ladies.
Bye.
Bye.
Bye. Thank you. Bye.
Right, so I think, bless her, she's trying to do what she did originally with the A and P and fit in as much as possible. We don't need to do that much because honestly, you lost me. Yeah.
So if you're going to have 4 sessions,